Dr. Gamble, currently testing for COVID-19 in Thunder Bay is only being done on people who have symptoms of the virus. Are we doing enough swabs at this present time?
I think that as far as the current swabbing policy and the number of swabs that are being done, we're kind of working with the material that we're given. There's limited numbers of swabs, and so what's been done is priority groups have been identified. And so at present, if an individual who has had symptoms and a travel history identifies themselves to public health, then they're referred over to our screening center and will be swabbed. Those folks that are admitted to the hospital that have a epidemiologic risk factor and also symptoms, and those individuals are being swabbed. Those selection criteria are changing on an ongoing basis.
Does wearing a face mask keep uninfected people safe?
Yeah, when you look at the newsreels from around the world, even here in Canada, you'll see people running around with face masks on, and I can say with a fair bit of confidence that the face mask is in the community setting is not going to do anything to protect you from becoming infected. We just don't have, certainly here in northwestern Ontario, we don't have it in the community, it's not prevalent in the community, and the mask is really not going to do a lot. Where the mask does have value is if you yourself are having symptoms of an influenza-like illness and you're coughing or sneezing a lot, that mask will block droplets that you may spray into the air, which may potentially put other people at risk. So in some ways, you wearing a mask is not an act of self-preservation, but rather an act of altruism. But if you think that it's going to stop you from picking up an infection out in the community, you're probably going to be a bit disappointed.
Mm-hmm. Is there any harm of people doing that to feel safe, like in terms of the health system and supplies and that type of thing?
Yeah. At the moment, it will put stress on our supplies, and it will end up diverting important supplies that really should be going to healthcare settings. So if people are out there buying masks, hoarding masks, really in Thunder Bay, it makes no sense for personal use. And those masks are being kept from places where you do have the potential for COVID-infected people to be exposing healthcare workers. And so in some ways you are doing harm with that.
Okay. Why do people, you mentioned this earlier, why do people have to stay as far as 6 feet apart in order to physically distance?
Yeah, well, I might be dating myself, but if you think back to the Charlie Brown cartoons, and there was a character called Pigpen, and when you saw Pigpen, there was always this cloud around Pigpen. And if you think about that and you think about yourself, what it is that, you know, in our speaking, in our coughing, in our sneezing, we put little fomites into the air, little particles into the air, and they kind of fall within that kind of Pigpen type radius. And so 3 feet is probably a reasonable sort of circumference around an individual where those fomites might fall. So if you want to keep from sharing your fomites with other people, your particles with other people, then you have to be at least 6 feet away, because of course you don't want to be exposed to the other person's fomites or droplet particles. And so there's the reason behind the 6 foot recommendation.
What should people do if they see someone not practicing physical distancing or know of someone who should be self-isolating but isn't?
Yeah, you know, a kind word can go a long ways. Certainly making sure that you're doing all of those things, modeling that behavior. People pick up on that. You may sort of gently remind somebody. Ultimately, if it is a case where somebody is defying a quarantine order or an order to self-isolate, contacting the local public health unit, they can sometimes bring some assistance to bear. But I think first and foremost, leading by example and the various places where we do have to go, the grocery stores, the pharmacies, they're helping us. They're putting little reminders out there. And I think that as people get used to it, it'll become second nature. But it's going to be a little bit tricky at first. And I think, just being kind to each other and gently reminding each other, that's probably the best way. Moral suasion, lead by example.
How can people in the community help the hospital besides just physical distancing themselves?
Yeah, I think that the hospital is a precious resource at this time and will be probably put under considerable stress if we get a sharp rise in COVID-19 cases here. Using the hospital when you need it, absolutely. But when you don't need it, take advantage of the other resources that are out there. A lot of the clinics in town are offering great virtual services, whether it be a telephone consultation or whether it be video conferencing right into your laptop if you have that capability. You just have to call your physician's office or your primary care provider's office, and they can do things for you. So hopefully you don't have to use things like the emergency room for simpler, more easy to handle problems. But if you do need the services of the hospital on an emergency basis, they're there for you. Other things, respect the visitor policy as it's put out. It's not done to be malicious. It's not done to be mean. It's done for a reason, and that is that we need to reduce the traffic into the hospital of all unnecessary individuals. And so, again, working with the staff, calling and speaking to them on the telephone rather than coming in, that's a good way of sort of heading off problems. Also, if you do come to the hospital for some of the services that we do have to offer and that you do have to get here, follow with the screeners, follow the instructions, be honest, be frank. If you are having a cough or a fever or some shortness of breath, don't come in. Call, contact your healthcare provider. There are ways of managing these things without you necessarily having to physically present yourself here.
It's great that select businesses are allowed to stay open as essential services, but how safe is it to go to the grocery store or the pharmacy, take-out restaurants?
Well, I can tell you this, to date there have been no cases reported of transmission as the result of picking up groceries or utilizing these services, with the proviso that you're following the recommendations, which is, again, proper physical distancing, good hand hygiene, making sure that if you're coughing or sneezing, that you're doing that into a sleeve.
Can people get the virus by eating take-out food or food that they buy from the grocery store, from ingesting?
Yeah. At this point, there's, again, absolutely no evidence that that's the case. It's still no reason not to, again, practice good hygiene. So obviously, sanitize or wash your hands, before you're cooking meals. If you're dealing with fresh fruit or vegetables, run them under water to clean them off. But you shouldn't have to be pulling out the wipes to wipe down boxes or anything of that sort. It would be highly unlikely that you would ever acquire infection that way.
So it's more from getting it through your eyes, nose, and mouth than it is, say, ingesting it.
Absolutely. Ingestion is not a way that you would pick this up.
Okay. Is there anything else you'd like the community to know, Dr. Campbell?
Yeah, I just want to say that, I moved up to Thunder Bay 20 years ago, and this is a really amazing community full of really, really great people. And I truly believe that just as the people in the hospital here are doing their utmost to make sure that we're ready to deal with the complications of this pandemic and to make sure that our people receive the best care, to to make it through. I also believe that the citizens of this city are also equally interested and willing to do what they need to do in order to make sure that we don't see spread. And I believe that with those two things going on, I think that we have a pretty good chance of, if you want, flattening the curve, or at least coming out of this a lot better than you've seen elsewhere.